Hello, good morning.
Hello.
My name is Reena Banerjee, and I am the Community Engagement Specialist Coordinator for ACDHH, the Arizona Commission for the Deaf and Hard of Hearing. So maybe you're wondering why you're here. We have a community view platform, and this is where we are committed to spotlighting and celebrating individuals and who have positions within our community who deserve recognition. And so today I'm excited to spotlight Lynn Myers. And then Lynn, thank you so much for joining us today.
You're
We're really
welcome.
looking forward to learning
Nice
more
to be.
about you and your role in the community. So Lynn, can you tell us more about yourself?
I'm a licensed professional counselor. I've been in practice for 35 years now. For the past 9 years, I've had a private practice, but before that, I worked in community mental health centers, group homes, substance abuse treatment centers, inpatient psychiatric unit, and then I also was a school counselor for 13 years.
Wow. Wow, you've been in a lot of different places within the community. So can you tell me more about what inspired you to focus in the field of mental health, advocacy, and to get involved in those organizations? What inspired that?
Well, actually, my undergraduate degree is in business, and I was even in an MBA program, but I went through my own crisis in my 20s and sought counseling. And back then, it was very difficult because there was a stigma attached to going to counseling and having mental health issues. And I just was drawn to, when I figured out how much that helped me, I wanted other people to know about that and to decrease the stigma in the community. Also, I've just noticed increasing number of homeless people, unsheltered people, and many of them, most of them have mental health issues. And so we need to address that in order to decrease homelessness and provide more services to people.
Oh, yeah, I 100% agree with that. So can you share your personal experience or your story that kind of showed you the importance of mental health awareness just based on your experiences?
Well, for example, if people aren't aware of someone who has mental health issues, they misinterpret their behavior. One example is in our neighborhood. I had a neighbor who was obviously had some form of schizophrenia and was under the influence of substance abuse, enter my house in a paranoid state. But luckily, because I had experience in mental health issues, I could slowly get him out into the public so the neighbors could call for services. That helped. I've been in other situations in public where somebody would be getting into an argument with someone who obviously was in a paranoid state, and it could have been really dangerous. And I wanted to step in and help explain that. So there's a lot of misunderstanding about mental health that I want to stop. And also, just with the increasing epidemic of suicidal ideation among adolescents, that's an important issue too.
So, what are some common misconceptions about mental health that you've
Well,
noticed?
Well, first of all,
Some-
I kind of alluded to it already, is that mentally ill people are dangerous. Most aren't, they're usually talking to hallucinations that aren't commanding them to hurt you in any way. So that's a big misunderstanding, that people with anorexia, for example, eating disorders, are greatly misunderstood, that, oh, they're just, going with the social media, and that anorexic people with anorexia could just eat. That substance abuse, should, you could just stop. It's a choice to use drugs. Willpower will help, and that's not a problem. I believe we should work at harm avoidance with people. Other myths are that if you talk about suicide with somebody, then they're going to go ahead and do it, which is totally incorrect. A lot of times, if you talk, that's the first step to a person accepting help. More recent one I see is that transgender people, adolescents who identify as non-binary or transgendered, it's just a phase they're going through and they'll change. Now, I grant it, a few kids are trying on different personas, but you can't just say it's a phase when people are struggling with disliking their bodies and their identity. So those are just some common myths I think people have.
Yes, thank you for touching on all of that. Yeah, there's so much more to think about. So, what do you think is the biggest challenge that is faced by people with mental health issues?
Well, right now, it's a lack of resources, access to affordable services. There's not enough licensed professional counselors or licensed clinical social workers to provide psychotherapy. And then the layer above that, there's not enough psychiatrists or psychiatric nurse practitioners to provide medication. And of course, we live in America, we don't have universal health care. So a lot of people don't have insurance, so they can't go to counseling, and cost is prohibitive if they don't have it. There are long wait times. So while someone's waiting for treatment, they will continue to use drugs and maybe overdose on fentanyl, or they may attempt suicide because they're so depressed. That's a problem. Continuing stigma in our society about mental health issues, although one of the benefits of the pandemic was that it increased mental health awareness. So more people are going to counseling. That's great. But of course, it's training the system. Some challenges specific to the deaf and hard of hearing community is there's a high incidence of substance abuse and domestic violence among people who are deaf. Substance abuse comes from, feeling isolated because you can't participate in a lot of things if you're not connected in the deaf community. And domestic violence can come from hearing people taking advantage of deaf people. Among the hard of hearing people, myself included, having grown up hard of hearing but been mainstream educated, a lot of low self-worth from having felt different, left out, not involved in anything.
Yes, thank you for sharing that. So, between the long wait times and looking for qualified professionals, what resources do we have in the state of Arizona that you would recommend for individuals who are seeking support?
Well, that's the biggest problem. If you're on Access, there are mental health clinics, but they have long wait times. For suicidal, of course, ideation, there's 988. There's also, and this is a great one for adolescents who don't like to talk on the phone, there is a text crisis line. I get to the exact one. I think it's 714, but I'll check that, where then if people don't feel comfortable talking about their feelings, they can text them that thing. There's the National Alliance for the Mental Illness, has a lot of support groups you can click and check into. There's a lot of 12-step meetings for various things. There's Alcoholics Anonymous, Narcotics Anonymous, and there's also Nar-Anon for family members who are involved with people who have substance abuse. I'm trying to think of what else. So unfortunately, like I said, it's very limited what's out there. There's also, there is, if anything, a person is in crisis, they can call the Maricopa County Crisis Line. And again, the easiest way to get those services is you call 988. But once you can get somebody to assess the situation, they then can provide you more resources.
Yes, that's good to know. Thank you for sharing that.
And the commission itself, as you are aware of, Reena, has a list of services on there, one of them being a list of counselors who provide services to the deaf and hard of hearing.
Yes. Yes, and I believe you're on that list. Great. So the last thing is, what are some strategies for self-care that you would recommend for others who just to use for every day?
Well, daily exercise is one. And I don't mean you have to pay to belong to a gym. Just taking a walk is fine. And we do know that nature improves mood. So you're much better off going and walking outside than walking in a treadmill. Obviously, heat is prohibitive here. So get up early or do it late at night. But if you can get some form of daily exercise. And while you're out there, don't be afraid to talk to people. We know that incidental relationships, those are the relationships with the person you see at the grocery store every day or the same postman, even those can be sustaining. Get out of your own self focus and volunteer. When you give to other people, you feel better about yourself. It gives you a sense of purpose and connection. Limit your social media because that causes what we call compare and despair. If I'm constantly comparing my inner feelings of low self-worth to somebody's outside persona of their, Photoshop pictures and only showing the best sides of their life, I'm going to feel less than, you know. Along the same lines as limit your news media consumption. A lot of times people are getting their news through TikTok or Facebook and Twitter, formerly, now known as X, and just scrolling and scrolling, you get feelings of hopelessness. It's called doom scrolling, because it's just negative, negative, negative. If you suffer from anxiety, there are a lot of free apps for mini meditations. I have one called 5-minute meditations. And so some people are like, oh, I can't sit that long and meditate. There's some great mini meditations that are free. You could just look for those in the Google Play Store. Another one we call setting limits and boundaries, which means saying no to unreasonable requests from other people. Here's the thing: when you say yes to people all the time and do what they want, sure, everybody will like you, but you won't be respected. They'll take advantage of you. So when you start saying, no, I can't do that, you might lose some people, some friends, but maybe they weren't friends anyway. They were just taking advantage of you, True friends will respect that you need to set limits. And you need to do this with yourself to get off the bandwagon that you have to be a super overachiever at everything you do. Last thing I would say is practicing gratitude on a daily basis, being appreciative for what you have. Some people say, what 3 things you're grateful for. Even if you can't, I say to people, just reflect on your day and think about what you saw that was beautiful or funny that day, because that it gets us out of the negativity. Sometimes we look at what's around us, and it could be something as beautiful as watching someone help someone else, or hearing or reading or seeing a funny joke.
Yes, that we're going to switch really quick.
Those were wonderful tips, and some of those I need to consider doing myself. I really appreciate you listing those off. There were a lot of different strategies that we can utilize to make ourselves do things that will make us feel better daily. Do you have anything else that you would like to add, Lynn?
I covered a lot. I would encourage people to look at a lot of the free resources online. Be careful, consumer, though, when you're looking at mental health videos online, because some people are just trying to sell you things. Some people can be way too dramatic, and you begin to think that you have a lot of problems wrong with yourself. So, make sure you check the sources. Are they coming from mental health organizations that are reliable, such as from the Commission, or from Mayo Health Clinic or other ones? There's a very good, because I practice my sign language online sometimes, I look at YouTube videos from something called the Deaf Counseling Center. And it's wonderful because it's deaf people talking about all their experiences with mental health, from domestic abuse to substance use to having been in a marriage with someone who was a narcissist, having experienced sexual abuse as a child. So the Deaf Counseling Center has great videos on YouTube.
Thank you. Thank you. We will definitely put a list of all of these resources together to share with the community. So thank you for sharing. So we're going to wrap this up. The purpose of this was just to create more awareness about mental health, the experiences, the challenges, and how we can journey through this together. So thank you for watching. If you have any questions, feel free to connect with ACDHH. You can connect with Lynn if you need to. All right. Have a wonderful day.
Okay.
Take care of yourselves.
Thank you. Good luck, everybody.
Thank you. Bye-bye.